All right, we have Mike here with us today to do our citizen science presentation. Thanks for coming, Mike.
That's it?
That's it.
All right.
You're on,
Okay. Well, thank you, everybody, for having me. I'm going to, for those of you I haven't met on the phone, I'm the Director of Research Programs here at the Foundation. And as part of what goes on in my department, we are running this online patient research community called Citizen Scientist. It's an initiative that we are very excited about. It's pretty new in the early days still, but we've had a lot of success, and we are very excited for the future. So today I had the opportunity to share with you what's going on that site. So I'll go through some of the history of Citizen Scientist, kind of walk you through what users experience as they participate on the site, some of the different features that they can take advantage of. And I'd be very open to any questions or comments, anything from the group as they go along or afterwards. So with that, a little bit of the history. So the history for Citizen Scientist goes back about 3 years to our former VP of Marketing and Communications, Katie Komen, who had the idea during Psoriasis Awareness Month in 2013 to create this little community for patients to answer survey questions online, be able to play with the data that was provided by everybody who was answering questions online, discussion, leave ideas, and just have kind of a nice little feature going along with Awareness Month that particular year. It was extremely successful. A lot of people came to the site. A lot of people answered survey questions. People really liked it. Really drove traffic to the site, engaged people, which is really the mission of that particular initiative. So that was great. It was a one-month thing. Moving forward, however, here's a look at it. I forgot I have a screenshot from what that actually looked like. Back in 2013, this is what it looked like. So this is what users would see when they logged into the original version of Citizen Scientist. Pretty attractive site, honestly. You can go through the questions. I don't have a screenshot of what you can see after this one. After answering a series of survey questions related to yourself and your experience, the patient's experience living with psoriasis or psoriatic arthritis, what they would see next as they were able to play with the data from the entire community and go from there, participate in discussions, and so on. After 2013, this coincided nicely with the development of the Foundation's ongoing strategic plan. As one of the key metrics of the research arm of the strategic plan, we are committed to engaging a community of at least 1,000 patients who collaborate actively in biomedical research. Now, the Foundation has a long and very successful history of engaging patients in research, primarily through the biobank, previous iterations of tissue banks, different things where we brought patients in, brought them to the table, either collected biospecimens from them, blood samples, DNA, or gotten their ideas and feedback to drive the research process. But with the onset of the strategic plan, with the success of Citizen Scientists as this community where patients were coming to the site, leaving research-related ideas, playing with data, really engaging in the research process, we found this to be a really good opportunity to meet this initiative of the plan. So it not only coincided well with the strategic plan, it also coincided well with a funding opportunity from an institute called the Patient-Centered Outcomes Research Institute, which is an organization mandated by the Affordable Care Act to drive patient-focused research. So projects that are driven to compare different aspects of the patient experience and look at how those improve or change the experience of a patient. So this specific opportunity became available through something called the Pipeline to Proposal Award, where through a 3-step process, early stage projects designed to drive patient research would be fostered along with funding from PCORI. So the first step of the process with a 9-month, $15,000 award. That would move on then to Tier 2, which was a $25,000, 12-month award, which just concluded, and now we're moving hopefully on to Tier 3, which would be a 12-month, $50,000 award. So this kind of provided this really perfect environment for us to build Citizen Scientists, moving forward to, with funding, with support of PCORI, to support our patients and to meet a metric of the strategic plan. So taking all this together, we devised a list of goals. The goals, many of them overlap very closely with what Corey wanted from this Pipeline to Proposal Award. We also took the opportunity to really match expectations of what we would want, maybe outside the expectations of that award. So first of all, the goal is to create a community. So along with the strategic plan, we want to host a user-friendly website for research-interested patients to engage with us and with each other. Next, we'd like to build a registry. A registry is a big database of information collected from a group of people, in this case, individuals with psoriasis or psoriatic arthritis, and to store that data so that it could one day be explored by researchers who can ask questions about what's going on with patients in the community. Next, we can use outcomes from the site to drive NPF programs. As patients engage on the website in the research community, we can take their ideas, identify their priorities to ultimately inform what we're doing, not only in research, but across all different departments at the foundation. And finally, comparative effectiveness research, which is really the drive of Corey, as I was describing earlier, to compare multiple aspects or interventions with the patient community to see how those different interventions compare against each other and ultimately affect patient outcomes. So through Citizen Scientist, we expect to be able to identify priorities to ask questions specifically related to this particular type of research. So do patients want to see intervention A versus intervention B, drug A versus drug B, any aspect of the disease experience to see what patients want to see most moving forward. Now here's what it looks like. So that foundation, that's the history of where Citizen Scientists came from, why we're moving it forward right now, why it's a really exciting, important initiative, how it satisfies a number of really important goals related to psoriatic disease research and activities at the foundation. And this is what we came up with. So working in collaboration with the Marketing and Communications Department, outside contractors, others at the foundation, we built this website, which you can find at the URL listed at the top of the page. Get to it through the psoriasis.org website and arrive at this landing page. So it's a really attractive website. I can say as somebody who's really not digitally inclined in any way, I personally think it's pretty attractive and easy to use. The buttons that you click are all nice and big, blue buttons with white letters that are easy to see, easy to go through. Landing on the site, you're presented with this, get a rundown of what you are expected to be engaging with, to see if you're actually interested in participating on the site, and you go ahead and get started. After going through an onboarding process where you provide your information, a very minimal level of information, we're not collecting deep details into the personal history or personal things like personal identifying information, that kind of thing from people participating. You're launched into a series of survey questions. So right now we have 56 survey questions up on the site, and instead of being presented in kind of a traditional read left to right, up to down survey format like a piece of paper, instead our user experience designers took this approach to make it more something like you'd see on a dating website, where you're, which I'm sure Pete's familiar with, where you're presented with really shortly worded, easy to answer, easy to understand questions, and easy to select responses, multiple choice answers. So for example, this first question, do you have psoriasis? Do you also have psoriatic arthritis? You click one or the other and you moved on to the next answer. And there's 56 of these. Some of them are short answers like this. There's 2 choices. Some of them do have a few more choices, something like 10, 20 choices to choose from. Things like which therapies have you taken, many different aspects of the disease, which you have more selections to choose from, but all presented in this very user-friendly way. On the right, you can see we've taken a gamification approach to designing the website as well. So to provide some more incentive for people to join the community and keep engaging, keep answering questions. They can level up depending on how many questions they've answered. And I think that's all we have built into the system right now, depending on how many questions you've answered. You can go to level 1, level 2, and so on. To ultimately, I guess, get to this cup which is nothing at this point, but something that we have the opportunity to add in the future. We haven't found, and I'll talk about some of the metrics in a few more slides about the extent to which people have engaged with us. We've had a lot of success in people coming to the site, answering questions, and really been a great success. We haven't really seen as much of a need for the gamification as we thought we'd have when we launched the site. Moving forward, as we try to engage people more deeply, this will be a great thing to have. And also layer in additional programs. We'll have an opportunity, maybe you go to a certain level, you'll then have the opportunity to participate in a new program or be entered into some drawing to maybe post a question to the site or something like that. We have a lot of opportunities for where we can take this. After answering the questions, you don't have to answer all 56 questions. You can leave this at any point in time. You can answer a couple questions and then stop answering questions, answer all the questions and move on. But after answering questions, you move on to different features of the site. The one that I think is most exciting is the discovery feature of the site. And this is where you can play with the data that's been provided by everybody who's answered survey questions. So right now we have about 2,800 people who have joined the site and answered questions. All of their answers are stored in a database in an anonymous fashion that can then be searched, can then be analyzed by everybody who has signed up for the site. So if you want to answer questions, go ahead and do that. But then if you want to look and see what kind of trends are happening with others who are on the site, you can do that as well. And to do that, we've created this a few different layers of functionality. If you look on the left over here, you can very simply select an attribute that you want to look at. In this case, I've selected age. So you can look at all the data for all the people who have answered questions, answered the question at least related to age, how old you are. Click that, and you can create here, for example, a pie chart, which breaks out all the different people. I'm sorry, that's really tiny on the screen. Breaks out all the people who are on the site by their age. So it says, I don't know what that says, I apologize, but 15% people between the ages of 40 and 49, 20% people between 18 and 25, and so on. You can then take it a step further using these additional features on the left. You can compare that attribute, so age, to other attributes. So if you want to compare that age versus maybe age of diagnosis or symptoms or something like that, you can do that. Or you can also filter the data. So you can take age and then you can filter that with something else. So I have an example of that right here, specifically looking at the numbers of cigarettes smoked per day. So if you want to see people who smoke a lot and see what the breakdown of people, what is the age distribution of individuals who smoke more than 20 cigarettes a day, you can ask that question by applying the filter. How many cigarettes? You can say, for all the people who smoke more than 20 cigarettes a day, which is one of the questions in the survey, what is the age breakdown of them? And you can see, I guess, kind of encouragingly, maybe in a way, that it's an older demographic of people who are saying they smoke a lot more. So we're not getting a lot of younger people smoking, at least in this particular pool of respondents. So you can apply those kind of filters and start playing with the data, asking your own questions, and really getting deeper than just answering a survey and then kind of leaving it to the researchers to do their analysis and go from there. You can actually play the role of a scientist, ask questions yourself, and those of us at NPF will be monitoring this and using this to inform our programs. And it will also be made available to researchers in the future for their analysis. I have a couple of other examples where you can do with the discovery portion of the site. I mentioned you can compare different attributes. You can also create different kinds of graphs, not just pie charts. You can also create bar graphs, as I've shown here, line graphs. We have plans to add a lot of different functionality to this particular feature, so you can compare things with different ways. You can conduct, hopefully, things like statistical analyses to see, is something really more than something else, depending on you see changes. Can you make conclusions based upon the changes that you see, that sort of thing. So in this case, I've shown just a bar graph comparing the age versus, again, the number of cigarettes smoked per day. So instead of applying a filter and just looking at people who smoked more cigarettes per day, you can look more granular and say, well, by age group, how many cigarettes are people smoking per day? So it kind of goes up and peaks somewhere around the age of, in the 50s here, in terms of number of cigarettes smoked. And as I said, you can present the same data in the form of a line graph if that is something you're interested in doing. So beyond the discoveries, we also host a very active discussion forum on the site. So after you create discoveries, you can play with the data. You can play with the data as much as you want without anybody else being able to see what you're doing. So you make your own graph, play with it, have ideas, change it. If you have an idea that you think is really interesting and you have a graph you want to share with other people, you can post that graph to the community. And that graph can then be used as the starting point for a discussion in a discussion forum. So this is a look at what we have at the top of the discussion forum right now. Discussion centered around the best season for each location of psoriasis plaque, types of psoriasis, triggers by age. So these are different graphs that users in the community have created, and then it's easy for other users to view this. They can join the conversation, they can see what's going on right here, and then they can join the conversation and engage in discussion from there. And if I were to click on this, it's just a screenshot. You'd see it would pop out to the whole series of discussions as you would see in any discussion. Finally, we have a develop feature of the website. So this is intended for people to leave we're hoping for kind of scientific hypotheses. People can, if they do an analysis, they've had a discussion, they have some ideas, they can leave something directly for us without NPF or anybody else engaged in the project going through and kind of reading between the lines, looking at a discussion, identifying a priority that way. They can do something for us. They can say, I think that younger people are more susceptible to X, or I think that whatever the case may be, they can leave that for us. This feature can also be used for suggestions for how you'd like to see us change the site. So things you'd like to see added. All that information is extremely welcome from the community, and we are using that to continue to build out the site. So just to look at how this kind of links back to our original goals, you can see how the discussion feature really provides this aspect of community. We were providing a community for people online to engage in research and research-focused discussions. We're building a registry of data through the My Data portion of the site. All the data that's coming in through the surveys is coming in and building a large database of information on the patient experience, which can ultimately be analyzed by researchers. Through the develop feature, and also just by looking at what's going on the site in general in terms of discussions and the different graphs being made, we can inform our programs, and then the comparative effectiveness research questions are really coming from that discover section where people are analyzing the data, and if patients are looking at the comparison between different treatments or that kind of thing, we can help inform our comparative effectiveness research efforts in the future. So a few of the metrics in terms of what's happening on the site so far. It launched last July at the Research Symposium and National Volunteer Conference that we held in San Francisco. The number of people who have joined the site since then is just over 2,800. I got these numbers yesterday, so it's up to date. The really remarkable thing, talking about that dating website design, which I can just see how it's really easy to go through the questions. We've had remarkable response. Evidently, this is like unheard of to have this level of response for people answering survey questions online. So more than 70% of the people, so more than 2,500 answered more than one question. So they joined the site, they answered that first question just to identify whether or not they have psoriasis, psoriatic arthritis, and then they've gone on to answer at least one more question. So maybe it's one more like I'm a male or female, my age, something, that many people. The number of people who have answered more than 40 questions is almost 2,000, so really a ton of people. So 40 questions going through the whole thing. Really, really excited by that number.
They're motivated.
Yeah, which is great. So really kind of always, that gamification feature is awesome, but it's kind of been on the back burner in terms of taking advantage of it. We're getting people to engage with the site very actively, which is great. And all that together has given us more than 100,000 data points. So that registry that we're building of patient data is large at this point.
Now, I didn't realize, because this was explained to us initially in Chicago 3 years ago. Was that Coleman that did that?
Yeah.
Presentation? I can't remember.
Oh, she must have. I was here. Yeah.
I mean, it was so fascinating. It was the first time we'd heard it and seen it, you know. But I didn't realize it took 2 years to actually get it up and going. It didn't launch until...
Right. So officially, this version, which is the version we intend to have living on our website indefinitely now.
This version.
Right. Actually, so that was terrific, that first version, but the opportunity with the funding.
Okay, I see what you're saying.
So the number of discoveries that have been posted is kind of lagging behind. So this is an area that we intend to focus on in the future. So of this 2,800 people who have engaged on the site, only 87 discoveries, so graphs, have been posted to the community. So we don't know what's going on in terms of people playing with graphs and maybe not posting them or having ideas and just not taking the step of sharing them with the community. But really motivating that is something we're interested in doing moving forward. I think it might draw people to the site. Oh, this is cool. I can answer questions, leave the data, and then I can actually look at the data and play with it. But then when it comes time to actually take that step and do it, maybe there's still I think there's a lot of education we can provide to help facilitate that process, and a lot of different things that we can do to help people take that step to share information with us and with the rest of the community. Nevertheless, 87 is pretty good. And if you look at most of those discoveries, there's some very active discussion around many of those. A lot of people responding to other people who have posted discoveries, different graphs, and that sort of thing.
Mike, do you find that it gets dominated necessarily by a person, a group of people that are almost like addicted to this thing? I mean, I could see how it could happen.
Yeah, I think that might be happening. I definitely see some of the same names popping up without doing any kind of formal analysis to see to what extent that's happening. Yeah.
But it hasn't been necessarily problematic yet.
No, and this is, I think it's tough and more the problem, but people are dominating it. They have just as much voice as anybody else.
Oh, yeah, It's not necessarily bad in a deal like this.
Right. But yeah, I think we do want more from everybody, and that is something that would be better, So those are some of the metrics in terms of who's on there. This is kind of a breakdown generally using Citizen Scientist to show you the breakdown of the individuals who are on there. So male versus female is majority female, about 65 or 70% female actually. If you look at the ages of those people who are engaged in the site, probably as you expect, kind of similar to the demographics we'd see in terms of the general population living with psoriatic disease. If you're then to look at the age of onset of psoriasis and individuals on the site, you find that most of them developed at an early age, or again, kind of to be expected, with kind of a little bit of a peak over here in the 40s for type 2 psoriasis. Yeah, but overwhelmingly, people develop psoriasis at an earlier age. Psoriatic arthritis, as we may expect, those ages of onsets are older. Looking at some other things that you can pull off the site if you're going to analyze the data on Citizen Scientist, you can see the regions where psoriasis is most bothersome. You find the majority of people complain that the scalp is the most bothersome location. Arms and legs also being, skin folds, I think is this green one. If you're on the site and you hovered over these different pie pieces, you'd see a pop-up of which value you're actually looking at. So I know when it's a screenshot you can't quite see maybe which is what colors kind of blend together. But it's an interesting look at the reporting in terms of the data on the site. In terms of the most bothersome psoriatic arthritis location, similar question this time from PSA. Find the knees and knuckles are the most bothersome from this group of individuals. And then psoriasis triggers. You can look at things like triggers. Is one of the questions that we asked, and find that stress in winter months are some of the most widely reported triggers for psoriasis. And a little bit of a different breakdown. Stress, a big one as well, but some other things kind of creeping up in terms of the different triggers of psoriatic arthritis. And here's a look at treatment by age group. Again, if you're on the website, you can hover over these different bars and actually see what they are, but kind of a look at, this is one of those questions that will have many, many different choices. Answering male versus female, psoriasis, psoriatic arthritis, going through the survey can be pretty quick. To get down to which treatments you might be on, you can see this is a lot more answers. We pull in a lot more data that way. And this here broken out by age group, you can see just different types of treatments that people are. What I've shown so far is kind of a look at just the data that's on the site, things that people would see in the registry, what people would see just to do kind of basic analyses of what's going on in the data that's being collected through the survey. As I mentioned, kind of the motive, we want people to be taking those next steps to apply some filters, do some comparisons, make some discoveries that they can post to the community to stimulate discussion and motivate activities at the foundation. So for that, we kind of want people to take the next few steps on the path of the scientific method, make observations and ask questions, start kind of playing, doing their own research, form hypotheses right here, and leave those hypotheses for us in the form of a section that I showed you where they can leave those hypotheses. From there, the intention is for us to kind of take the ball and run with it, either to put in research proposals for us to work with collaborators, or internally to pursue bigger research projects, or to build initiatives at the foundation around those different ideas. Those to demonstrate some of the power that you can, that Citizen Scientist provides to take these next few steps from the observation along to the road to hypothesis. We look back at that treatment by age group figure that I showed in the last slide, and we can ask a question on top of that. So first you can look at one attribute, maybe compare the age to what kind of treatment people are on, and then ask the question, are young patients more interested in online care? I know some of you in the room have seen this slide, so I haven't. That's kind of an interesting idea, I think. You know, do you think people who are of a younger age group would be more likely to use online care versus those who might be more used to the traditional means for receiving care? You can ask that question by applying a filter using those, the different functionality of the site. And find
younger people are more computer savvy,
and
more comfortable with it versus especially older people.
Right, exactly. So that's kind of what falls out here. You find that 51% of people, age group 18 to 25, are extremely likely to take advantage of online care versus about 30% of people in the age group 61 to 65. So just the kind of thing you can start to explore. And the point you bring up is really important, I think, that people, things might seem obvious, you know? It's like, of course, younger people want online care versus older people, but seeing the data really helps inform decisions on many levels. People don't like to assume things in that way. It might seem like, of course, second nature, we understand this, but this really helps inform not only programs, but decision makers. You know, they want to understand, well, I think that's the case, but is that really the case? Is something going on that we didn't foresee or didn't expect? So this kind of thing is interesting in that way. Another interesting question that you can ask using the site, you can look at psoriasis versus psoriatic arthritis, and you can sort it out to see how many people have trouble sleeping. So on the left here, I'm showing a figure, psoriasis, people with psoriasis on the left, and then the blue portion of that bar are individuals who do have trouble sleeping. People with psoriatic arthritis, again, blue, do have trouble sleeping. So about half of people with psoriasis report having trouble sleeping. About 75% of those with PSA report having trouble sleeping. And then the question could be helping to sleep. So kind of, maybe younger people would naturally be more likely to use online care. Maybe people who are able to exercise are more exhausted at the end of the day, something like that, but then able to rest better despite symptoms associated with the disease. And at least based on this group of individuals, that does seem to be the case. So you find that filtering this particular set of data by individuals who only say they are physically active, you find that only about 25% of people with psoriasis in that group have trouble sleeping, and closer to 50% of people with PSA have trouble sleeping.
That's interesting because I would think the main factor, and we learned this at the FDA meeting, the people that have difficulty sleeping with psoriasis was all about the itch. That was all about the itch, right? So it's hard to see why physical activity necessarily would affect that. Yeah, but I don't know, who knows?
That's a great question. That kind of leaves us off at the next step where we take it from there. Because I was actually about to say the word itch, probably because of what happened at we learned at FDA. You're exactly right. It seems like despite itch, or maybe is it having an effect on the itch? If you like, blood flow or something changed. I mean, there's a lot of questions left.
You're right.
But it's kind of interesting little.
That's what makes it so much fun.
Yeah, it's cool. So the final example I have up here is looking at alcohol consumption. So you can break down the data by how much alcohol people report drinking. So at the top, people who report not drinking any alcohol at all, or at the bottom, 10 or more drinks per week. You ask a question, the patients who identify alcohol as a trigger drink less. So we can sort the data further by that, thinking maybe that If you do identify it as a trigger, you don't drink alcohol because it's a trigger, or maybe something else is happening. And we find actually that something else is happening, and that people who identify alcohol as a trigger actually are kind of moderate drinkers, at least according to this data. And maybe that's you have to drink alcohol in the first place to notice that it's a trigger. So of course, there's more to this data than just what pops out through these filters. But just a demonstration of some of the interesting things that you can do. First, pulling out the data, looking at what's going on in the community, and asking some deeper questions, doing some comparisons, applying some filters, and then, like Pete said, leaving it off with some more interesting research questions to be pursued down the line. So future plans for the project. One, as I said a few times, we want to more deeply engage the patients in the community in the research process. So wildly successful, having people engage in the site, leave information to build the registry and build this database. But then facilitating and motivating people to take those next steps to learn more about the data, ask questions, leave ideas. We want to add more strategic questions to the site. So this is happening now. Some questions to kind of more directly sort of crowdsource information from people. So we can get all these different questions to the survey about the experience living with the disease. But then maybe, we want to identify priorities, and we've kind of started off thinking we could just look at the data and identify priorities and get ideas. And strategically ask questions directly, is this more of a priority than that? As we go down the path and we use the site more, we need to add questions that are more informative and more strategic as well. We want to make the data available to researchers, so we have plans to kind of make a research backend on the site where researchers can submit applications to citizen scientists to get access to the data to pursue specific research projects. We also work very closely with a team of research partners. We have 5 research partners, experts around the country, who help inform activity on the site, and they already are kind of looking at the data and will have access to the data to do research projects moving forward.
Who are these people?
So we have, it's 5 people. It's Joel Gelfand in Philadelphia, Junko Takeshita in Philadelphia as well.
Physicians?
They're physicians, clinician scientists for the most part, yeah. April Armstrong in California, Jay Wu in California.
Do they collaborate with their information, do they?
So they are more kind of on the oversight of the project side. So they help decide which questions to put up there, the different functionality we should add to the site. We check in regularly just to kind of track what's happening.
So they're monitoring, too.
Yeah, exactly. And then,
that's what was one of my questions. Who does that?
Right. So they're doing monitoring, and then in addition to us, the foundation. Yeah. So really been great partners. We also have 8 patient partners directly engaged on the site. So people who've been with us from the beginning as kind of governance council, we call it, helping oversee activity on the site, kind of providing that feedback if we're doing things that make sense to them, or should be adding things or changing things. And finally, we have plans to add kind of data linking functionality and add new functionality to the site, things like an app, things like I said, building out gamification, maybe linking with other initiatives, using this kind of a launch pad, other different things inside the site, added features, or outside as well. So we expect scientists to live on psoriasis.org and definitely moving forward. A lot of opportunities. That researchers are really driving this arm of the mission. So that's the last slide I got. Thank you all for your attention. Are there any questions?
I got a question. Randy sent the board of directors a, I want to say January or February. Was it from the organizing group about the success of this group and several other groups, and it was almost like an award-winning kind of deal that they were so impressed. Do you know what I'm talking about?
I don't. I'm not
Maybe
sure.
It was the organization that brought this thing together that gave the grants.
Oh, maybe.
I can't remember who it was. I'd have to look back.
See, I know, but there's been a lot of interest and attention on citizen scientists. So I know Faster Cures, this organization, was very interested. They are very interested in what we have going on here. And Leah Howard was able to give a presentation at the recent meeting. I think that was last December. Maybe that came out afterwards.
It was pretty impressive.
Yeah.
They talked about some other like sort of sites, but we were superior to the other ones in almost every facet. It was pretty remarkable. Then they talked about how, I mean, I got the impression anyway that the foundation could be pretty profitable for the foundation eventually in selling the data.
Yeah. That's another thing that I have not mentioned is that we, one of the ways plans to build this out is to kind of make maybe a subscription model, because we know right now pharmaceutical partners, anybody can get on the site. You can, if you don't have psoriasis, psoriatic arthritis, the first question you can actually click a box that says I'm not a patient, and then you can see the data. You just can't answer any questions. And thinking about adding like a subscription layer, so maybe having a free version of the site where you can do certain things, you can answer the questions, and then maybe you can do a bit of analysis or see certain things, but then have a paid subscription where you can maybe access the data more deeply, do different analyses, do different things. So, and we definitely think there will be demand for that in the future.
Sure.
And in the next year, we're also looking to validate this data. So that's one thing that we don't, it could be the same person on there 2,800 times answering all the questions. That's probably not it, but just to get a sense of how valid it is. I think it's going to be, we'll be able to get a sense of what we have here and how valuable it would be there, So that's something we're going to do over the next year, so that hopefully a year down the line, we can start making this as well.
Yeah, it's great.
Any other questions?
Hi, this is Jamie. I have a question.
Go ahead.
Hello? Okay. Can I make a suggestion to the site?
Of course.
When you go to log in, if you don't know your password, can there be a button that you press that you get an email sent so that you can switch your password?
Yeah.
I can't log in now.
You're the second person today to report that glitch, and it's a bad oversight on our part. We have no way of retrieving your password right now.
Oh, really? So
yeah.
if you forget it, you're dead.
Yes. You can always log back in and still look at the data, and the data you provided will still be in the system. You can create a new username, but we're going to fix that. So we have, there's some other things. We know the Remember Me feature when you log in. I found out today that doesn't work either. They're building a website. We're getting it going, and that's something we're going to address.
I think it's great, by the way. I love the whole site. I did it when it first came out in 2013, and then I did it again when it was kind of relaunched. But I wanted to get back in tonight, and that's when I realized that I'm out for a little bit. So just wanted to let you know I love everything.
Yeah, thank you. And sorry about that. That really is a bad oversight on our part. 6 months down the line, and now I know it's a problem, and we'll fix it. We have plans to actually integrate the login with the psoriasis.org login down the line. We've got some details to work out, like in terms of the consent and the different things, but that would make it much easier than it would just be part of your NPF website login.
I think it looks really cool. This is Janice Bender, and I'm going to give it a try. Thank you for such a excellent description.
Thanks.
Do the advisory groups, the patient group and the medical group, I guess you'd call them, research group, do they report to you then, Mike?
Yeah.
Okay, so you get their feedback.
I do, yeah. So we get, we have regular calls with them.
Mm-hmm.
They're always able to contact us. A few times we've kind of broken off small groups of them just to have some more targeted discussions about features on the site and how to do some things.
Another feather in the cap of the foundation. I mean, it really is. It's a great feature.
Yeah.
Most nonprofit health-related organizations don't have anything like this. They don't have anything like this. Amazing, really.
Anybody else have any questions? All right, well, I guess we will let you enjoy your evening. I'll send out a reminder when our next quarterly meeting is coming up, and I'll also, this has been recorded, so I will send the link out to you tomorrow.
Thank you very much.
Thank you.
Thanks, everyone.
That's great. It's great.
Great.
I couldn't have